Lyme disease is a bacterial infection that is spread to humans by infected ticks. Lyme disease is not contagious. Although Lyme disease is not a common infection, we do see a higher number of cases in the west of Ireland due to the large national park in Connemara. The ticks that cause Lyme disease are commonly found in woodland and park areas. This is because these types of habitats have a high number of tick-carrying animals such as deer, mice and sheep. Due to their breeding patterns, the tick population is highest in late spring and early summer. If a tick bites an animal that has the bacteria, they can also become infected with it. The tick can then transfer the bacteria to a human by biting them and feeding on their blood. In general, the longer the tick has been attached to the skin, the greater the risk of passing on the infection. It is uncommon for the infection to be passed in the first hours after a bite, which is why it is so important to look for ticks and to remove them. The problem is that the ticks are very small and they do not cause pain, so it can be difficult to realise that you have a tick attached to your skin. The most common symptom of early stage Lyme disease is the appearance of a distinctive skin rash that is known as erythema migrans. This is also referred to as a target lesion. This rash looks like a bullseye in the centre of a dartboard and develops at the site of the tick bite. The skin affected by the rash will look red and feel slightly raised to the touch. The size of the rash can range from small to large. Other symptoms of early stage Lyme disease may include the following: fatigue or tiredness, muscle pain, joint pain, headache, fever, chills, and sometimes neck stiffness. Risk factors for Lyme disease include any activity or occupation that involves prolonged exposure to woodland and park areas like hiking, camping and outdoor picnics. Lyme disease can be a difficult condition to diagnose. While the characteristic skin rash can provide an important clue, not everyone with Lyme disease may develop the rash. Oral antibiotics are recommended for the treatment of early stage Lyme disease. The best way to prevent getting Lyme disease is to be aware of the risks when you visit areas where ticks are likely to be found and to take sensible precautions. You can reduce the risk of infection by being aware of ticks and which areas they normally live in, wearing appropriate clothing in tick-infested areas like a long-sleeved shirt and trousers tucked into your socks, using insect repellents, inspecting your skin for ticks, particularly at the end of the day, including your head, neck, hairlines and skin folds, which includes your armpits, groin and waistband. Making sure that your children's head and neck areas, including scalps, are properly checked, checking that ticks are not brought into your home on your clothes, and checking that pets do not bring ticks into your home in their fur. If you find a tick on your skin or your child's skin, you should remove it by gently gripping it as close to the skin as possible, preferably using a fine-toothed tweezers, and pull steadily away from the skin. If you are worried that your child may be developing Lyme disease after a tick bite, you should go to your GP or go to your nearest emergency department to have your child seen.